Hello everyone, I am Sushrita Mahadani and currently I am pursuing fellowship in Pediatric Optometry from Indian Academy of Optometry. So today I will be discussing about a few topics of vision therapy. But before going to that, we all need to know what is vision therapy. Vision therapy is a program that aims to improve a person's visual abilities. It uses a wide range of programs, that is eye exercises, patching, testing, and with lenses and prism and with synoptophore we can measure. So today we will be discussing a few of them. The first is the pencil push-up therapy. Pencil push-up therapy is commonly prescribed eye exercise approach for convergence insufficiency. Typically, this exercise is done with a pencil or any other object of the same shape. The goal of the exercise is to keep the pencil clear and single for as long as possible while moving the pencil close and far from the nose. Now I will explain the procedure of pencil push-up test. The patient will hold the pencil at arm's length like this way, and he will move the pencil closer to the nose. Once the patient sees it's double, he will reply. Now again we will move back until it is single. We will do this experiment twice. At arm's length first, then we will move the pencil closer.
Double. Single.
Okay. By this way we can check the convergence insufficiency. The next is any vision therapy software, that is iNet program. It is marketed by Home Therapy Solution. In system features there are 12 programs, 6 of which are assigned for the completion by the patient 5 days per week. In treatment or therapy, it includes activities like letter jump or visual search of a certain target. This treatment is also designed to improve eye-hand coordination, visual acuity, crowding effect, and visual memory. Next is prism or lens fixation. Prism-based therapy exercises can facilitate changes in all of the visual field areas. This involves posture, balance, coordination, and cognition. Yacht prism are the most powerful therapeutic tool that serve to actively train the brain for improved processing of visual information and enhance the way vision therapy exercises are performed. While wearing the prism lenses in vision therapy sessions, it not only improves the visual information but also improves a person's vestibular, proactive, and tactile information. Next, I will be speaking about patching therapy. The medical eye patch or patching therapy is the oldest and most common treatment for amblyopia. Covering or occluding the good eye with an eye patch forces the brain to use the weak eye. The ultimate goal is to improve the clarity of vision and encourage the use of both eyes together. It is considered as the first line of treatment for amblyopia or squint. Eye patches for moderate lazy eye is for 2 hours per day with 1 hour of near vision, and for severe cases it is 6 hours per day. Now I will explain the procedure of patching. By this way we will close the patient's good eye. This way we will patch the good eye and do some near exercises. We will ask the patient to read some.
Accuracy and precision. Titration true value is equals to 7.00 molar.
Okay, thank you. Now I will be speaking about is synoptophore. Synoptophore is an instrument for assessing binocular vision, measuring angle of deviation and binocular anomaly by conventional orthoptics method. It is based on haploscopic principle. It is used to detect the potential of binocular function in presence of manifest squint. It is also used to detect suppression and abnormal retinal correspondence. It has 3 grades. So, the first grade is simultaneous perception, tested by 2 dissimilar but not mutually antagonistic pictures such as a bird and a cage. The second grade is fusion, ability of our eyes to produce a composite picture from a similar picture which is incomplete by a small different detail. The third is stereopsis. Stereopsis is the ability of our eyes to produce an impression of depth by superimposition of two images of the same object which is taken from a slightly different angle. Synoptophore is also used to measure normal and abnormal retinal correspondence. It is done by measuring subjective and objective angle of squint. If the subjective and objective angle of squint is equal, then it is normal retinal correspondence. But if the objective angle is greater than the subjective angle, then it is abnormal retinal correspondence. And the difference between two angles, subjective and objective, is called the angle of anomaly. With this, I end my topic here. Thank you, everyone.